The novel coronavirus, COVID-19, affects older adults at a higher rate and severity. 8 out of 10 COVID-19 deaths have been in the older adult population, ages 65 and older. Adults 85 and older are 13 times more likely to be hospitalized and 630 times more likely to die from COVID-19 than the 18 to 21-year-old comparison group. Vitamin D status may affect one's likelihood of contracting COVID-19 and the severity of their illness. Low levels of vitamin D are associated with various health problems, including hypertension, type 2 diabetes, and cancer, which have been found to be linked to worsened COVID-19 outcomes. Vitamin D has also been found to have effects on immune cells. Older adults are at an increased risk for vitamin D deficiency. Other risk factors for vitamin D deficiency are reduced intake, increasing adiposity, decreased synthesis, and decreased time spent outdoors, which all may be common in the older adult population. From March to August 2020, a few studies about vitamin D status and COVID-19 outcomes in older adults were published. A commentary was published in the Journal of Nutritional Science as a plea for prospective randomized studies about the potential for vitamin D status as a protective factor for COVID-19. The team explained that more COVID-19 cases were in the Northern Hemisphere, where vitamin D levels tend to be low. They also stated that vitamin D reduces the expression of what seems to be a COVID-19 binding spot in human tests. The German cohort ESTER study used their records to research if vitamin D insufficiency or deficiency was a predictor of respiratory death. They found that vitamin D insufficiency and deficiency were both strongly associated with respiratory disease mortality with a 95% confidence interval, and they found that this was particularly strong in women as well. The authors suggest vitamin D supplementation could contribute to lowering mortality from respiratory diseases, and they say this could be a particularly cost-effective measure to fight against the COVID-19 pandemic. 2 prospective cohort studies were formed in March to investigate vitamin D status in patients who tested positive for COVID-19 and the outcomes of their disease. One cohort was formed in Switzerland, which had 107 patients with a mean age of 73. The other, in UK, had a total of 105 patients aged 65 to 102. The reports had very similar methods, both gathering patients symptomatic of COVID-19 and testing them for COVID-19. Then the participants had their vitamin D levels tested. Both studies found COVID-19 patients to have statistically significant lower vitamin D levels than non-COVID-19 participants. But the UK study did not find an apparent difference in mortality between the vitamin D deficient COVID-19 group and the vitamin D replete COVID-19 group. The Swedish study suggests vitamin D supplementation to prevent COVID-19 infection, while the UK study suggests that vitamin D status may be a prognosticator for COVID-19 and supplementation might improve outcomes. Vitamin D is important for the older population to protect bone health, as well as potentially decreasing risk of COVID-19 infection in combination with social distancing and wearing a mask.